Dr. Danyo, welcome back. How are you, my friend?
I am doing great. I'm excited today. We've got Dr. Goldstein here.
Dr. Goldstein, we've got a new physician on the team. Sound
Yes,
the
Dr.
alarms, sound the bells. This is a big deal.
Very excited to be here.
I was hoping for this episode on the podcast to get to hear a little bit about who you are, Dr. Goldstein. I really would love to just learn a little bit about why Dr. Danyo is excited about this, what this is going to add to patients that you all are serving. So to kick things off, Dr. Danyo, I want to spin this over to you, and I want, in your own words, tell me a little about, could you kind of give me the preview of Dr. Goldstein, and then, Dr. Goldstein, I want to hear from you on kind of the gaps that he might have left. So, Dr. Danyo, why are you so excited about this?
Well, I mean, I'm excited to have a colleague, in the practice. I mean, if you think of like our medical lives, I mean, we come from very different backgrounds. I'm like physical medicine, rehab, pain management. Dr. Goldstein is coming from the emergency medicine world. And so we have like kind of different hard drives in how we approach patient care. And really, I think as physicians, you become more effective based on going through some really tough times. And a lot of the tough times deal with patient encounters. I'm sure Dr. Goldstein will tell us, but in the emergency room, I mean, you're just sitting there and you could have a major trauma coming in, a car accident, heart attack, I mean, major things, or you could have somebody who's just got the sniffles. But all of these challenging cases, and we've talked about this in pain management, you get really stressed, you're trying to intervene, and that creates basically these levels of competence. And so having another doctor with a different background, we approach patient care differently, but then ultimately we come together and there's more to offer for a patient. So this, from my standpoint, is like really exciting. Dr. Goldstein and I really have so many commonalities. I think our personalities are similar. We've talked about the fact that I've done Ironman competitions in the past. So has Dr. Goldstein. In fact, we did the same race, not even knowing each other.
That's right.
At the time in 2015. We did Chattanooga Ironman in 2015. We were both doing that race. So he comes with kind of that same passion for wellness. Doing an Ironman is not a simple task. You need a lot of endurance. And I think doing hair transplant, I mean, that's what you need, a competent physician with a lot of mental endurance and the ability to hang in there with these long, tedious cases to provide the best results and still be smiling at the end. So that's really how I feel right now. I'm just really excited. Dr. Goldstein and I have been communicating for some time. He spent a lot of time in our office just kind of observing, and we went to the International Hair Restoration Society meeting in Denver this past year, and he was there the whole time, kind of seeing the industry as a whole and what the hair restoration industry has to offer him and his family and in our practice, and just kind of feel the vibe, which is really good right now. So that's how I stand. I'm really excited.
I love that so much, and I'm going to shift it over to you in just a moment, Dr. Goldstein. But what I'm hearing you say, Dr. Danyo, is you all have some differences, but you also have these commonalities, and when you put those together, it's better care for your patients, and that's hard work. I can't imagine the endurance that it requires. I mean, you're on your feet, you're so focused on one thing for several hours, very, very detailed work, so it makes sense. You can't just bring anybody into that, and they have to have the right mesh with the team. So that's so cool, and in a background. Yeah, please.
Clark, you brought up the team. This kind of process of bringing on another physician, I mean, this has been a multi-year process, and the process actually started with getting physician support with our really dedicated and highly qualified physician's assistants. My first physician assistant, Lena, we've kind of calculated that she's actually placed close to 1 million grafts, if not more, And there are very few physicians that can say that, using pen implanters. Kaylee, my other physician, comes from cardiac surgery. She's got incredible skills from a surgical standpoint. So they complement Dr. Goldstein, who compliments me. So there's not only one provider, me, there's actually 4 providers now in this practice, and we work together. It's an amazing thing. So
Excellent. But speaking of the background we were talking about earlier, emergency medicine. Dr. Goldstein, could you tell me a little about, for someone like myself, I've never been engaged with that. I would just love to learn a little bit more about your background with that. And I'm curious if there are some connections of how those experiences bring additional value for patients.
Well, sure. Yeah, I've been practicing emergency medicine in Metro Atlanta for about 25 years. I've worked from trauma centers to community emergency departments, and during that time I've had an opportunity to see a very wide spectrum of patients. As Dr. Danyo and I talk about, in the emergency department, you're typically seeing patients kind of in their worst moments. And what's refreshing about hair restoration in our practice is we're seeing patients nowadays in their best moments, and we're making people very happy. And that's what I found so attractive about making this transition.
We always will hear stories of high fives and hugs, and like when people come back for their follow-up. That's one of my favorite things Dr. Daniel will talk about. So I definitely feel like that's got to be a real feel-good for everybody, this whole team supporting.
Well, we experienced that yesterday with somebody that literally was just passed over by other practices and basically told there's nothing that can be done. He had, I think, like 7 transplants before, but with plugs and lots of scarring, and it just very unnatural look. But he came back. In fact, we've done a video online. His name is Mike. And what a great follow-up. And Matt, you can talk about that feeling of gratitude that he had. I mean, I think we all had a little tear in our eye when we experienced his appreciation for what we did for him. But it was something that was creative, I think, and something that, we just had a passion, and we really kind of stuck in there and created something. But you were witness to that, which was great.
Yeah, I had the opportunity to meet Mike, and he told me his story, kind of going back to the 1990s when he had FUT procedures and hair plugs, and it didn't go well for him. And then he met Dr. Danyo, who's been taking care of him, and he looks great, and you can see he's a happy person. He's got a great demeanor and a great smile, and at the end of our encounter, he gave us hugs and told us what a difference Dr. Danyo has made in his life. And
well, he was also, he looked like he was working out. He looked great. Yeah.
You really helped transform the whole, it's an exterior procedure, but you're really changing more than just that.
And I think since, with all the time you spent with us, patients want to be here. They didn't necessarily want to be in the emergency room.
That is true. Yeah. Patients and their families in the emergency department didn't plan to be there. They don't want to be there. They want to go home, or in some cases be admitted to the hospital. And the patients we take care of here, they want to be here. They look forward to their appointment. They know that after a day with us, their appearance is going to change, and their sense of well-being is going to change, and they're happier people, and they feel more confident, and it's just a great opportunity to be a part of.
Well, congratulations on growing the team. Those high fives, those hugs, those great moments. Now you're able to amplify that because not just anyone can do procedures like this. And so I know you're really picky, Dr. Danyo, about your team. And so having a new physician on the team is so exciting. So Congratulations. And I'm so excited about the future.
I am too.
Me too.
Thanks for listening to Hair Restoration with Dr. Daniel A. Danyo. Book your consultation today with Dr. Danyo by calling 678-845-7521 or online at nahairrestoration.com. And be sure to follow, rate, and review this show wherever you listen to your favorite podcasts.